Hi, I'm Lisa Davis. I'm so glad you're listening to It's Your Health, and I'm also thrilled to have Leslie M. Rickey, MD, MPH, Associate Professor of Urology and Obstetrics, Gynecology, and Reproductive Science at Yale University. Hello, Dr. Rickey. Such an honor to have you on the program.
Hi, Lisa. It's great to be here. Thanks so much for having me to talk about this important topic.
Before we jump into the topic, I just want to mention I really admire when doctors get their MPH. Now, I have my MPH, but I'm not a doctor, so I didn't go as far as you. But I love having an MPH. What made you want to get one? And for people who don't know, that's a Master's of Public Health.
Right. Well, I went to Tulane Medical School, and they had
Nice.
an opportunity to get a combined degree during medical school. And to be honest, at the time, I thought I was going to go into pediatrics and be doing sort of public health projects. I'd done a lot of volunteer work growing up,
Cool.
and it just seemed like a really great opportunity. And Tulane has a great school of tropical health and public medicine. So it was a little tough at times when everybody else was, celebrating after a big exam, and I had to study for another test every now and then. But it was really worth getting.
Oh, that's fantastic. All right. Well, today we're going to be talking about something called PeriCoach. It's a new FDA approved pelvic floor training system for women. This is very exciting because apparently 1 in 3 women over the age of 18 experiences involuntary urine leakage. And I can say, being a woman in my mid to upper 40s, I guess at this point, I will sneeze and I'm like, oh, darn it,
Yes,
So,
it is common, and it's I think the 1 in 3 is accurate. We've seen that in many studies in the United States and in other countries, and it starts slowly. It does have the potential to progress, and so we're really trying to promote kind of the concept of pelvic floor muscle exercises and lifestyle changes and things that you can do for overall long-term wellness for your pelvic floor.
my mother talked about Kegels when I was growing up, and she always reminded me as when I was an older teen, you got to do your Kegels, you got to do your Kegels, right? I know my mother
As
was.
a teenager, you're like, whatever, mom.
Yeah, right. Exactly. So many things I should have listened to. So, what makes a Perry coach different? Does it make it easier to do the Kegels, or is it different than Kegels? Talk to us about this.
So I think so. In my practice, which my practice is devoted to pelvic floor disorders in women, we see a lot of women with urinary tract symptoms, especially leakage or going to the bathroom frequently. And so the mainstay of therapy is talking about the pelvic floor. So we examine women's pelvic floors. I ask them to squeeze their pelvic floor muscles, the good old Kegel as you were referring to. And some women can do it. Some women can't do it at all. Some women need a certain amount of coaching in order to get them to find those correct muscles. So you have some options when you recommend these pelvic floor muscle exercises for women, which I do recommend for pretty much anybody that has leakage, even if it's mild leakage, because it can prevent progression and even cure the leakage. So the options are to go home, to say, okay, here's some instructions, and go do 3 sets of 10 exercises a day, or there are actually physical therapists who have taken women's health courses. We call them pelvic floor physical therapists, and they can provide coaching and feedback, and also it's feedback on progression, and so you can see your improvement. The problem is there's a niche in there, right? There's a little bit of a gap in there. So some women go home and they really want to do them, but they might not be doing them properly. They might forget to do them. I think many offices, probably like mine and probably like a lot of the OB-GYNs after a woman has delivered, hands them a piece of paper with some instructions on it, some pictures, and say, okay, I'll see you back in 3 months. And I think it's just, it's sort of a passive engagement. I think what the PeriCoach offers as a home exerciser is one, a way for people to do these exercises in their own home and maybe not have to go to a physical therapist, although the physical therapists are a wonderful resource, but maybe you're a new mom, maybe you're working, maybe, you just can't get to a physical therapy office. So I think it offers a way for people to do these exercises at home. And I think with the free app that comes with it, that there's a biofeedback component. So the device itself goes into the vagina, and it has some biosensors on it that measure your squeeze and then send that information to your phone, which is right next to you, and you get this biofeedback, which is on the screen. You can watch yourself squeezing, and then also important is relaxing the pelvic floor afterwards, and also track your progress, also get reminders to do it, and I think it's a really powerful way to actively engage your patients, and I think it helps them remember to do it because they have like a hook, right? It's like a
Oh,
hook.
definitely. No, I want to try this. I mean, I love the idea that you can actually see how you're doing because you're right. Sometimes you're not sure if you're even doing it right. I mean, even now, I'm like, wait, am I doing this right? I'm trying it now. Like,
Right,
wait,
and
am I
then
doing?
people get but you should be able to sit and do. I mean, I'm not,
Yeah,
you should be able,
yeah,
or stand in line at the store. I mean, that's
sure.
the whole thing. But if it were, I think it's just. I mean, I think the great thing of the PeriCoach too, it's kind of like people compare it to the Fitbit. Sometimes you get nudges. It becomes part of your life. I mean, who used to worry about 10,000 steps a day? Now, I mean, you can't go. Someone's like, hey, I got to go. In mid sentence, I got to go walk like 20 more steps. So I think it's also a way to make it like a normal part of your exercise. Like you go to the gym, you do your steps, you do your pelvic floor muscle exercises.
Ah, yeah. See, I like that. I like that. Now, where do we get this?
So right now it is by prescription. So you can either go to the PeriCoach website and there's a prescription that you could download and take to your physician, or in my office we just have the prescriptions there that we can just fill out. So you do need a prescription, but I think the great thing about this product, because I do have people coming into my office sometimes with something they found online and they want me to order it for them, and some of them are frankly a little scary.
Oh,
So this product's FDA approved. It's a medical device. It's medical, grade quality. So I think more and more people are going to be hearing about this. So they're not going to have to look over, oh, what is this thing, But for now, it's also great for women that are doing a little bit of research online and find it, print it out, bring it in, and I think because of all of the lead up and study that this group has done, that the doctors are going to be happy to sign it, and it's also nice to have a tool to give your patients when they go home, because I want them to get better. I've told them about these exercises. I want them to be able to go and do them. I don't want them to waste 3 months of their lives and come back and tell me, oh, I forgot what you said, or I forgot how to do it. Like, this makes, good, efficient use of their time with high yield.
oh, definitely. Now, I would assume if you went to your doctor and you said, I have minor leakage or major, whatever the issue is, that they would give you a prescription, correct? Because now I'm thinking, oh, I got to go to my doctor and get a prescription. Now, do you think I would assume you have to see your gynecologist, or can you talk to your general practitioner? What do you
No,
think's best?
no, I think absolutely. I don't think I think you could go to your primary care physician with this prescription, or you could go to your gynecologist, or you don't have to go to a specialist like myself. And in fact, I mean, I would hope that this is captured more at that stage, because the people that I see tend to have more problems. I would like the people that are just mildly symptomatic to go see their doctors about it and think about this therapy. There's a study that showed that 30% of women that leak once a month will progress to once a week leakage within 2 years.
Oh my
So,
goodness.
yeah, if something like this can help prevent that progression, I think that's great.
Oh, I think so too. Again, this is called the PeriCoach. It's a new FDA-approved pelvic floor training system for women. It is now available. Be sure to ask your doctor about this. Dr. Rickey, is there anything else you'd like to add?
No, I just want to say it's been a pleasure being on the show. I encourage women not to ignore these symptoms. It can affect other medical conditions. It can get worse as you age and affect your overall wellness and ability to exercise and do the activities that you like. So I think it's something we really need to start talking about more and taking control and seeking treatment for.
Oh, I completely agree. Dr. Rickey, thank you so much for being on the show.
Thank you. It was a real